Hi everyone, and welcome to Obeid Dental Journal Club. It's been a while. We're going to kickstart the Journal Club again. The formula is going to be as usual. We're going to have the article available for everybody to read and prepare for the review. You can watch it either on Facebook by liking us at the Obeid Dental Journal Club, or you can actually watch the whole review on the YouTube channel that we have for it. That's the Obeid Dental Journal Club channels on YouTube. The first article that I decided to kickstart the new season with is a review article. It's an interesting article because I like review articles, and I'll tell you why. The article is Clinical Performance of Dental Implants with a Moderately Rough TiUnite Surface, a meta-analysis of prospective clinical studies. The reason why I like review articles is that you get a lot of information from just reading one article. Especially in the introductions, there is a lot of review of articles and then a lot of references to the specific points that they are trying to make. So in the introduction, there is valuable information that you can pick and choose from. During the discussions and the result, there is a lot of information that you can get, but I think a good introduction, good historic review of the topic, and then the discussions will cement the idea of what the article is all about. In this particular article, basically, before we go into it, it will be nice to just quickly review the types of implant surfaces and see why and how each surface differ and the advantage or disadvantage for each one of them. Historically, we started with the machine surface, that is the original Brennemark implant. Then we find out that if we put a little coating on it, whether that coating was HA, which is hydroxyapatite, whether it's titanium sprayed like the TPS, that increase the retentive elements of the bone to the implant. But the problems with those, what we find out in the future, is that the moments that these surfaces get exposed, the moment that we start having periodontal issue around the implants, which was the magic of the machine surface titanium. EU was great as far as the peri-implantitis disease prevention. Then right now, I think almost all implant company are looking at some type of a medium rough surface, whether that medium surface is acid etched and blasted, or anodic oxidations. Either one of these, basically, that's the norm right now. The questions that always come in: how much rough is too much? And that is the beauty of the review articles that I'm going to have it here with you. When you look at acid etch and anodized and biosurfaces, it's a surface that's been roughened in hope that by creating pits and grooves and valley, that cells will get in and get into these lacunae and help into making the bone healing faster and more stable. And you can see when we look at the SEM slides that each surface, when you look at it under the microscope, it has a different character to it. So the whole idea is, when you have the cells, is that the osteoclast and osteoblast will work very well with that surface. We don't want the cell to recognize that surface as a bad surface and try to invade it as a foreign body and try to get rid of it. Although we want to have the good cells coming in, like that surface, goes around it, hugs it basically, and create very solid bone and maintain that bone contact for a long period of time. Again, the advantage is faster bone healing, and by blasting and roughening the surface, we increase the contact area between the implants and the bone. The disadvantage always, when the rough surface gets exposed, it's very hard to keep it clean, and sometimes we see increase of the peri-implantitis with the rough surface being exposed. So get back to the article. We have two, I will think, top reviewer, top scientists in the field, well known, They independently evaluated all articles identified in initial search, and then what they wanted is they wanted to do prospective study design, minimum of 20 patients treated with this specific implant surface, and the follow-up of at least 12 months. After they looked at it, the conclusion was that exclusively based on the prospective clinical report on dental implants with a TiUnite surface, it demonstrates high implant survival and good marginal bone level maintenance. The prevalence of peri-implantitis is low and similar to result reported with other moderately rough surface implant brands. The result of this analysis indicate that implants with TiUnite surface provide a predictable treatment modality in a variety of a situation. Why do I like the conclusion, and why do I, the little details about this review article is, one of the authors was very well known to start working with a company that worked with a machine surface, and then went on to work with developing a rough surface. And every time we see him on the lecture circuits, it was always about downplaying the TiUnite surface. I care less for the system, care less for the surface. I'm just trying to say that a lot of time you have to read or review whatever comes out of the research report with a grain of salt. You have to see the particular of each study. Who is behind it? Who is financing the research? And by diving deep into the articles and dissecting it pretty well, you can start seeing which is good and which is not. And that's actually why I wanted to have this journal club and kickstart it again, because I think I can go ahead and be able to read those articles and be able to help you and guide you into which of the philosophies and ideas are good and which are just not good. So please stay tuned. The next article will be in a week. We're going to try to do it on a weekly basis, and the next article will be more a clinical article review. So thank you for your attention, and we'll see you next week.